Honorable Ministers, colleagues, a very good morning to all of you. First of all, I would like to congratulate PPD Secretariat on successfully holding the annual meetings of PPD. We welcome the theme of this session, promoting South-South cooperation for attaining ICPD and the Agenda 2030, which is both timely and relevant. PPD as a platform provides a great opportunity to the member countries to cooperate and help each other for the achievement of the agenda of ICPD and the agenda of 2030. Realizing the challenges emerging from the fast-growing population, Pakistan has set an ambitious agenda to ensure universal access to family planning services and to increase the contraceptive prevalence rate to 50% by the fiscal year 2025. The government is fully committed to accomplish the Sustainable Development Goals by reducing the maternal mortality rate, infant mortality rate, and under 5 mortality rate. Efforts have also been made to ensure the universal access to reproductive healthcare services across the country. The Council of Common Interest, under the chair of the Prime Minister of Pakistan, has approved a set of recommendations to achieve the population stabilization in the country. And they have been translated into an action plan 2020 to 2025 in consultation with the provincial and regional governments. These are as follows. The 8 thematic areas which we are focusing are as follows. To establish the national and provincial task forces for steering and providing the oversight and taking critical decisions to reduce population growth rate, lower the fertility rate, and increase the contraceptive prevalence rate. Ensure the universal access to family planning and reproductive healthcare services. And increase the financial allocations by the provincial and federal governments. And legislations regarding the Reproductive Health and Family Planning Rights Bill, Child Marriages Restraint Act, Premarital Counseling. Advocacy and communication. Training and curriculum, which include the population studies and population dynamics in the educational curricula. Ensure the contraceptives commodity security and strengthen the supply chain management system, and seek the support of the religious leaders. The action plan is aimed to achieve the following targets, that is to increase the present contraceptive prevalence rate of 34% to 50% by 2025 and to 60% by 2030. Reduce the present total fertility rate at 3.6 births per woman to 2.8 births by 2025 and 2.2 births per woman by 2030. Lower the present average population growth rate of 2.4% to 1.5% by 2025 and 1.1% by 2030. In addition, a national task force on population to steer and review the progress on National Population Action Plan has been constituted under the chair of the Honorable President of Pakistan, with its members including the chief ministers of all the provinces, 4 provincial and 2 regional task forces on population under the chair of the respective chief ministers have been constituted. Furthermore, the federal government has set up a fund, namely Pakistan Population Fund, with an initial allocation of PKR 1,000 million, and a donor conference has been held under the chair of the Honorable President of Pakistan for tapping resources for population program. In order to make substantial progress on Goal 3 of Sustainable Development Goals, that is good health and well-being, Government of Pakistan has given priority to strengthen health sector to further resolve and address the outbreak of COVID-19 pandemic, enhanced effective coverage of skilled birth attendants, improved public sector health facilities, increased number of basic health units, and rural health clinics equipped with essential services are the reflection of these priorities. To enable the effective family planning, pre- and post-pregnancy care and neonatal care, the Lady Health Workers Program revitalized through adequate training, support, and a revised service structure. Pakistan's infant mortality rate has declined along with the neonatal mortality rate. Percentage of birth attended by skilled personnel is increased from 58% in 2015 to 68% in 2020. And maternal mortality rate has fell from 276 maternal deaths per 1 lakh births in 2006 to 189 in 2019. So the government is committed to increase its critical workforce from 1.45 to 4.45 per 1,000 persons in line with the World Health Organization guidelines. With a population growth rate of 1.9%, Pakistan's contraceptive prevalence rate in 2019 stayed stagnant at 34%. So the COVID-19 pandemic is the biggest public health challenge of the world have faced in recent times. Pakistan is committed to provide efficient, equitable, accessible, and affordable health services to people of Pakistan with the aim to create a productive workforce for the future that could efficiently contribute to the development of the country. To conclude, we assure that the government of Pakistan is committed to strengthen the PPD platform and to promote the South-South cooperation for attaining the ICPD and the Agenda 2030. And we look forward to have joint ventures, especially in the field of manufacturing commodities locally, with PPD Secretariat and the member countries in different areas of family planning and reproductive health. Thank you very much for giving me the opportunity.